This is a video to display how type 2 diabetes, hypertension, and coronary artery disease are related.
When you eat something, the food becomes a source of energy called glucose. Glucose is the food our cells, and insulin is needed to allow the glucose to enter the cells.
Insulin can be seen as a key unlocking a door. The glucose cannot get through the door without the key.
In type 2 diabetes, the insulin in your body does not work properly because the cells do not recognize the key. When the glucose cannot get into the cells, it is left to free flow in the bloodstream. This can cause blood sugars to rise.
Along with blood sugars rising, people that have type 2 diabetes can also have increased triglycerides and cholesterol in their bloodstream. This is due to an alteration in the way they can metabolize lipids or fats.
This is troublesome because with increased cholesterol, plaque can begin forming within the arteries of the circulatory system. This is also known as atherosclerosis. This plaque can continue to build up and harden, which narrows the artery and makes it stiff.
This is a healthy artery. It's nice and red on the inside and quite pliable. My breath represents how blood would flow through the artery. When you blow through the tube, the air passes quite easily and with minimal force. In an artery that is forming plaque, it is harder for blood to pass through the artery, just like it's hard for air to pass through the tube. This is how diabetes can lead to conditions such as hypertension.
Let me talk to y'all and just, give you a little situation. Listen.
Hypertension is also known as high blood pressure. The plaque that forms in the arteries makes it harder for your heart to pump blood to the rest of your body. When the heart pumps harder, the volume of blood pumping through your arteries increases. If the plaque is present, the amount of space that the blood has to travel through the artery cannot change. The plaque has made the artery hard and stiff, so it cannot expand and accommodate the increased volume of blood that passes through it.
This can cause serious problems if the pressure keeps rising and building up. It can cause small pieces of plaque that has formed in the artery to break and flow freely in the bloodstream. During their circulation in the body, they may get stuck and block blood flow. Platelets and red blood cells can also adhere to the fragment of plaque and make it bigger. When this occurs, coronary artery disease develops.
The artery becomes inflamed because of the fragments of plaque, which makes the artery even more narrow. Blood pressure would then continue to rise and could lead to the rupture of a plaque buildup or plaque lesion. This results in multiple fragments that other cells can adhere to, which then can grow and become lodged in places such as the legs, arms, brain, lungs, or heart.
To prevent this from happening to you, do not smoke. Make sure you eat lots of fruit and vegetables. That means cutting down on pizza. Have a regular exercise routine that allows you to be active for 30 minutes at least 5 out of 7 days of the week.